Okay, so like imagine surgeons, right? But they're perfecting these really complex surgeries,
Mm-hmm.
not in the operating room,
Right.
but in like a virtual reality setting. It's
Mm-hmm.
kind of mind-blowing when you think about it. But how effective is this VR training, really?
Yeah, definitely. And that's what we're diving into today. We're looking at a really robust meta-analysis from the Journal of Medical Internet Research.
Okay.
And they really try to get to the bottom of that question.
Awesome.
And this wasn't just like a small study or anything.
Right.
We're talking 31 different studies,
Right.
over 2,400 participants.
Wow. That's a lot.
It is, and importantly,
Okay.
randomized controlled trials, which is like the gold standard for research.
That's reassuring, especially with how much information is out there about this topic. So before we get into it, can you give us a little rundown of the differences between traditional medical education and this VR stuff?
Yeah, totally. So
Okay.
picture this. You've got your medical students,
Mm.
they're buried in textbooks, going to lecture after lecture, right?
Yeah.
VR kind of flips that on its head.
Yeah.
Instead of just reading about it, VR immerses these learners, right in the thick of it, in a computer-generated 3D medical world.
So instead of just reading about anatomy,
Exactly.
it could be like virtually holding a heart.
Exactly. Rotating it, dissecting it, you name it.
Oh, wow.
It transforms passive learning into this, like, engaging experience.
That's incredible. So it sounds like this could really help bridge that gap between, knowing the theory and actually being able to apply it.
Absolutely.
But does it actually lead to better learning?
Yeah, that's the question, right?
Yeah.
And the research seems to point to, yes,
Mm.
it seems like VR training really does lead to more effective learning.
That's so interesting. And, this meta-analysis
Yeah.
looked at knowledge versus skills, right?
Right.
So let's start with knowledge. Did VR, outperform the traditional methods?
So, in a nutshell, yeah,
Yep.
students trained with VR had a statistically significant improvement in knowledge retention
Wow.
compared to, the lectures and textbooks.
Even a little bit of an edge in medicine could make a huge difference.
Absolutely.
It's not just about memorizing, it's about actually retaining the information.
Yeah, for sure.
But what about applying all of that?
Right, and that's where VR really shines.
Okay.
We saw a moderate to large improvement in cognitive skills
Oh, wow.
for the VR trainees. That's awesome.
Things like critical thinking, problem solving,
Yeah.
decision making in these realistic scenarios,
Right.
which is really hard to get from traditional methods.
That makes sense.
Yeah.
Like, it's one thing to memorize a textbook, but it's another to actually apply that
Exactly.
in a real medical situation.
For sure.
Can you talk a little bit more about, like, what kinds of cognitive skills VR helps with?
Yeah.
And what makes a VR program that does that well different from a more basic one?
So you can kind of think of it as a spectrum of how interactive they are, right?
Yeah.
So on one side, you might have a program where you're just watching a 3D heart.
Right.
On the other side, you're in a virtual operating room, you're diagnosing a patient.
Wow.
You have to make decisions in real time based on their symptoms.
That active problem solving, where you're mimicking those real-world situations, that's where we see these skills develop the most.
Okay, that's amazing. So the more interactive, the more you have to think on your feet in that simulation, the better.
Absolutely.
But obviously, nothing is perfect.
Right.
What are some of the things about VR in healthcare education that we still need to look into?
Yeah, I mean, this is really just the first step.
Oh.
Like, we need more research on the long-term impact of all of this.
Right.
Like, does it actually lead to better outcomes for patients down the line in the real world?
That's a good point.
Yeah,
We can't just get excited about the early results. We need to keep studying it.
exactly.
And another thing I'm thinking about is cost.
Right.
This technology is not cheap.
Yeah, no, it's definitely not cheap.
Did they look at, is it worth the cost compared to the traditional ways of teaching?
It's interesting. Only a couple of the studies even mention cost at all.
Really?
Yeah, and none of them actually compared it to traditional methods,
Wow.
which is a big deal because obviously that's a huge factor for hospitals.
Absolutely, yeah. If they're going to implement something like this,
Exactly.
it's got to make financial sense, too.
Yeah, for sure.
I wonder if future research could look into ways to make it more affordable without, making it less effective,
Absolutely.
like maybe different platforms or software options.
For sure. I mean, there's so much variation in the types of VR programs they use in these studies.
Right.
It's hard to even say what the best practices are,
Yeah, for sure.
We need more standardization.
Okay, so it seems like there's a lot more to learn. And, this research was mostly focused on doctors and nurses. But There are so many different types of healthcare professionals out there.
Absolutely.
What about using this for pharmacists or dentists?
Right, right. Or even therapists.
Yeah, exactly.
That's a great point. We need to make sure that everyone benefits from this, not just a select few.
Right. It shouldn't just be for the people who can afford it.
Exactly, exactly. Every field has its own challenges,
Mhm.
and we need VR programs that meet those specific needs.
Yeah, that makes sense. And I mean, with technology changing so fast,
All the time.
who knows what VR training will even look like in a few years?
Right.
But I think it's important to remember with all this excitement that it's just a tool, right?
It is, for
That
sure.
it's all about how we use it.
Exactly. And that brings up a really important point that often gets overlooked.
It's easy to get caught up in like what VR can do,
Total.
but we also have to think about the responsibility that comes with that.
Exactly.
Yeah.
Especially in healthcare education. We need to make sure that we're developing and using it responsibly.
Right, we can't just throw technology at a problem and hope for the best.
For sure.
What kind of ethical things do we need to be thinking about here?
Well, for one thing, we have to make sure everyone has access to it.
Okay.
Like we've talked about how awesome VR could be for training,
Right.
but it's pointless if only the schools with tons of money can afford it.
That's a good point.
Right. So bridging that gap is super important.
Yeah, totally. Everyone should have the chance to benefit from this technology. So it's not just about making it affordable, it's about making sure the programs themselves are inclusive too, right?
100%. Like the VR programs need to be culturally sensitive.
Okay.
They need to represent all kinds of different patients.
Right.
And we have to make sure we're not accidentally building bias into them.
That's a really important point.
Yeah, I mean, if VR is going to be a big part of how we train healthcare professionals,
Yay.
it needs to reflect the real world.
Yeah, it has to work for everyone, both for the people learning and the people they're going to be treating.
Exactly.
Well, this has been really eye-opening.
Yeah, it's been great.
I mean, it seems like VR has so much potential for healthcare education.
It really does.
But like we've been saying, we have to use it carefully
Absolutely.
and always be thinking about the bigger picture.
Yeah, and I think that's what makes these deep dives so interesting.
For sure.
It's not just about looking at what's right in front of us.
Yeah, it's about really digging into all sides of it.
Exactly.
So to everyone listening,
Yeah?
we want to hear from you.
What do you think?
What are your biggest ethical concerns about VR in healthcare or anywhere else?
And how can we make sure we're using it to help everyone?
Let us know what you think. Thanks for listening, and we'll see you next time.
See you next time.